Hello, my name is Dr. Selva. I'm a consultant obstetrician and gynecologist at Mahkota Medical Center, Malacca, Malaysia. Welcome to my video podcast entitled Surviving Private Practice in Malaysia. This is my fourth video podcast entitled Clinic Systems in Private Hospitals in Malaysia. Since the 1990s, private hospitals have mushroomed in Malaysia. In 2018, the total number of private hospitals in Malaysia was reported as 240, as opposed to 144 government hospitals. The biggest groups of hospitals are Kumpulan Permodalan Johor (KPJ) with 27 hospitals, Pantai Gleneagles Group with 15 hospitals, and Columbia Asia Group with 13 hospitals. In 1994, I joined a brand new hospital called Mahkota Medical Center in Malacca. It was originally built and owned by the Lions Group. Dr. Jack Chiang, a Taiwanese hospital builder, was employed by the Lions Group to build this hospital. It was built based on the Taiwanese concept whereby everything was owned by the hospital. The doctors just walk in and work for a percentage of the procedure fees. This was a new concept in Malaysia. All other private hospitals had a system where the doctor's charge is separate from the hospital charges. In this new system, the doctor gets 1/3 of all procedure charged to the patient. So for a certain operation, if the procedure fees is Ringgit Malaysia 3,000, then the doctor gets Ringgit Malaysia 1,000. The hospital will charge extra for any disposables used during the surgery, but there is no separate OT usage charge or instrument charges for all reusable items used during the surgery. This system was very attractive to young doctors like me. It is good because since our fee is directly attached to the hospital fee will not be increased unilaterally without increasing the total bill. As all of us were young and keen to do more cases even though we get less money per procedure, we had a chance to perform more operations. This was very good for me. Since I was just starting to perform laparoscopic surgeries, the time taken to perform laparoscopic surgery was obviously long. The hospital charges were the same whether I took 1 or 3 hours to perform the surgery. The only difference was the cost of the extra drugs used during anesthesia. The anesthetic fees was also 30% of the surgeon's fees, and so all the charges and the doctor's fees were tied together. We were able to control the patient's bill and kept it to the minimum, thus attracting more patients to this new hospital. As for outpatient services, we are given codes for consultation fees. The fee was Ringgit Malaysia 30 for the first visit and Ringgit Malaysia 20 for a follow-up visit. We get 30% of the total ultrasound charges as the machine belonged to the hospital. As young specialists, we were very happy with this arrangement because we need not come out with any capital when we started working in this hospital. During the economic crisis of 1998, Lions Group decided to sell off the hospital because it was not doing well. The Ballastiers Group of Singapore, headed by Dr. Gan See Kim, bought the hospital at a very reasonable price. The new owners thought that the system in the hospital is only benefiting the doctors and not the hospital. They decided to change the system to the Mount Elizabeth Hospital Singapore model, whereby suites were created to sell or rent to the doctors. In this way, they could raise cash for the running of the hospital. They created suites ranging from 400 square feet to 1,000 square feet on the first and second floor of the building. The doctors were very unhappy and revolted. As a result of the unhappiness, 10 doctors decided to move to another hospital called Specialist Medical Center Malacca, which was owned by a group of doctors. Later, this hospital was sold to Pantai Group and it was renamed Pantai Aikro Medical Center. I remained in Mahkota Medical Center. I rented a 920 square feet suite and after a year bought it for a premium. My contract with the hospital allows me to dispense drug and do procedures in the clinic. I am also allowed to collect cash from patients in the clinic. This was a complete change from the way we worked before. At first, all of us were very unhappy with this arrangement. However, over time, we have learned to recognize that this is a very good system. Since then, the hospital's fee structure remained the same, namely we get 1/3 of all surgical fees. Although in the initial agreement the management was not supposed to charge for the usage of any equipment used during surgery, this has changed over the years. Gradually, patients are being charged for the usage of special equipments used during surgeries. There are basically two types of clinic systems in private hospitals in Malaysia. Number one, the hospital owns everything and the specialists get their income from consultation fees and doctors' fees for procedures done in the hospital. Some hospital charges their doctors rental for clinic usage. In some hospitals, they may even need to pay nurses' salary. The KPJ Group, Pantai Group, Columbia Asia Group of hospitals and many other private hospitals use this system. Number two, consultant owns clinics in the hospital and uses the hospital for their inpatient facilities. Only 4 hospitals I know of have this system, namely Gleneagles Hospital, Kuala Lumpur, Mahkota Medical Centre, Malacca, Putra Hospital, Malacca, and Pantai Air Keroh, Malacca. However, in both Putra Hospital and Pantai Air Keroh, Malacca, this privilege is not extended to all new doctors joining the hospital. Let's look at some of the advantages and disadvantages of the two different systems. The advantages of owning a clinic in the hospital are: number 1, you can run the clinic the way you want. Number 2, you can collect cash in the clinic. Number 3, you can buy your own equipment. Number 4, you can sell drugs in the clinic and earn from it. Number 5, you can employ your own nurses. Number 6, your clinic value may appreciate over time. Number 7, you may be able to take assistant doctors. Number 8, you have your own space to place your personal things. The disadvantage of owning a clinic in a hospital are: number 1, you have to pay rent or pay a premium to buy the suite. Number 2, you have to pay maintenance fees. Number 3, you have the burden of paying your nurses' salaries. Number 4, you will have the burden of paying leasing for all your equipments. Number 5, even if you want to get an assistant, the hospital may not give the rights for the assistants to work in your clinic. Number 6, you may not be allowed to sell the clinic to anyone else except to the hospital because the person who wants to buy your clinic may not be given practicing rights in that hospital. The advantage of not owning a clinic are: number 1, you don't have the burden of paying rental and nurses' salaries. Number 2, you don't have to keep stock of drugs and medical supplies. Number 3, you don't have to manage the clinic and the staff. Number 4, you don't have to worry about collection of money and pilfering of drugs or stealing of money by your staff. The disadvantage of not owning a clinic are: number 1, you may be moved out of your clinic space at any time by the management. Number 2, your nurse may be changed by the management as they wish. Number 3, you have to work with equipment decided and provided by the management. Number 4, you cannot try out new treatment strategies as everything must go through the management. Number 5, you cannot differentiate yourself from your competitors in terms of providing superior service or competitive pricing. In conclusion, I foresee that no private hospital is going to have the system of owning your own clinic in the future. Private hospitals have learned that total control of the hospital is to their advantage. They can dictate to the doctors what they want to do. As a young specialist, this system is good for you. This will allow you to establish yourself and have your own clientele at a low initial cost. However, as you grow older and have more patients, you will prefer to have your own space and clinic so that you have a better control of what you do. Unfortunately, this is not going to happen in any Malaysian private hospitals in the future. As more and more specialists come out to private practice, I predict that a new system will emerge. In the future, private hospitals are going to employ doctors so that they will have absolute control over them. Thank you for watching this podcast. Please subscribe to this channel to learn more about private practice in Malaysia. Bye.